We understand that individuals who come for the service really are in a high stress situation. They've just been given what is pretty consequential news. And what are they trying to do? They're trying to understand what their options are. They're trying to understand, is the diagnosis correct? They're trying to really get that peace of mind that they're managing their health most effectively.
New choices, new players, new models of care. Consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered healthcare. What if healthcare was actually centered around what consumers need and expect? We're talking with leaders who are making it happen one experience at a time. I'm Jared Johnson, and this is episode 394. Today, we have the flavor of the week about Target announcing another 2,000 wellness products. How does Target see wellness journeys differently than the sick care industry? And what can we learn about two of their strengths, merchandising products and providing a distinguished experience? I'll talk about that. Then we welcome Frank McGillin, CEO of the Clinic by Cleveland Clinic, to talk about virtual care trends that their team is seeing by region, the impact of specialty care deserts, and helping patients manage their emotional journey. It's time for the awesomeness. Are y'all ready? Let's go.
Flavor of the week.
Target is literally doubling its commitment to wellness with plans to introduce more than 2,000 new items across multiple categories they announced in January. One of my favorite retailers, and I'll get to that in a minute, apparently decided that announcing 1,000 new wellness products a year ago wasn't enough. Their expanded assortment, including emerging and only at Target brands and partnerships, will help consumers discover new categories like functional beverages, hair health, and wellness technology. Some of the new products and brands for 2025 include beauty and health self-care, men's wellness, nutrition and gut health, activewear and loungewear, functional beverages, which are non-alcoholic drinks that contain ingredients to provide health benefits beyond basic hydration, and wellness tech such as SLF's red light therapy LED face mask, Therabody's smart goggles sleep technology, and the latest Oura Ring. Relative to other retailers, Target has essentially been a category unto themselves when it comes to health and wellness, not just from what they have done, but from what they haven't done in the space. Namely, they haven't placed billion-dollar bets acquiring primary care brands. Some have wondered ever since Amazon acquired One Medical if Target would enter the fray, but to their credit, they seem to have focused on what they do best, merchandising products and providing a distinguished retail experience. There are lots of positive signals in this announcement. First, the scope of the new offerings. 2,000 new products, including 600 Target exclusives, represents a real commitment. Second, the fact that they didn't reverse course after making a bold bet last year with the aforementioned 1,000 new wellness products. Third, including categories like wellness tech in the mix. And fourth, having the customer-focused brand equity to back it all up. For those following along, this is the perfect entry point for me to make my annual or semi-annual prediction that if any retail brand could make a bold entry into patient care that actually moves the needle in the right direction, I believe it would be Target, as one of the better brands in the space, one of the better in-store experiences in the space, and one of the best loyalty experiences in the space. I will say this though, lest I be accused of playing favorites. I do have an unsolicited suggestion that if they do want to make a move in this direction, they could start with that loyalty program. Target Circle gives members a 5% discount to pay with their Circle card on a lot of items, but not prescriptions, over-the-counter items located behind the pharmacy counter, glasses and contacts, or clinical services such as eye exams. Who knows, maybe that'll be next year's announcement. So wherever they go next, it's safe to say that Target sees wellness journeys differently than the sick care industry, and with a combined 3,000 new products announced in the last 13 months, they appear to be placing their bets for health and wellness directly on their shelves. Let's pay attention to how Target is repositioning health and wellness choices one product at a time. That's another way that we'll build the healthcare of tomorrow, and that's the flavor of the week.
The flow.
All right, everyone, let's get to the flow. Please join me in welcoming our guest this week. I'm here with Frank McGillin, CEO of The Clinic by Cleveland Clinic. They're the joint venture between Cleveland Clinic and Amwell that are a leading provider of virtual second opinions. There's a lot of data we have that's fresh off, out there to dive into about what that means, about where virtual second opinions are coming into play for consumers and how it helps us better understand what options there are for someone's health. So with all that, Frank, welcome to the Healthcare Wrap.
Jared, great being here. Thanks for having me.
Why don't you give our listeners a little bit about who you are and what you do?
Sure. So heading up the Clinic by Cleveland Clinic, I joined the company in 2000, and we started the company really at the beginning of the pandemic. So I guess a great time to be starting a virtual health company. My background is a combination of leadership roles across health tech, both consumer as well as capital medical equipment and healthcare technologies. And it's really been about how to bring new technology to market, how to help consumers. And, having started in consumer businesses, I always try to take that consumer approach as I'm thinking about bringing new solutions to market.
I love it. Well, we could probably spend a whole episode talk about insights you've gained along that journey. And what I think we can just dive right into today is some new data from the clinic that has been released just a few weeks ago. And it is specifically about how it reveals some regional and condition-specific trends from patients who are using virtual second opinions and how that helps kind of guide some individuals' health journeys out there. I'm not sure where you'd want to start on here, but is there anything about this data set that you'd like to mention? And then maybe we can dive into some of those particular journeys and condition-specific pieces that it revealed.
Well, our mission at the clinic is really about unlocking access to world-class experts. And if you think about conditions like cancer, complex cardiac conditions, that really there's a big gap in terms of both the patient demand as well as the supply of quality and quality expertise. We commissioned a survey last year to look at, where we were seeing the growth of the business, where we were looking at really the demand, and we saw that there were regional skews. Now, being based in Cleveland, you can imagine the Midwest is a high source of a lot of the patients who come in for a virtual second opinion. And in terms of why people look for a second opinion, it's generally they're facing consequential decision. Do I have surgery? Do I have this complex intervention? Have I gotten a life-changing diagnosis? Those are reasons that people come to the clinic for a second opinion. And we found that despite the fact that Cleveland Clinic has Midwestern roots, has a strong basis in Florida, we were seeing demand across the country. For example, 14% of the second opinions we do are from patients on the West Coast. And I think the reason that they're coming to us from the clinic is couple things. First off, and it really starts with the quality of the specialists. Cleveland Clinic has 3,500 specialists, and subspecialists are really top of their field. So it starts with the quality. Second is we make it really easy, and it gets back to my whole point about being consumer-centric. We understand that individuals who come for the service really are in a high-stress situation. They've just been giving what is pretty consequential news. And what are they trying to do? They're trying to understand what their options are. They're trying to understand, is the diagnosis correct? They're trying to really get that peace of mind that they're managing their health most effectively. So we really designed the program around making it easy, taking a lot of decision-making away, or supporting that member in terms of the decisions they need to make. For example, matching them with the right specialist who really is best suited for their specific needs. Taking away the burden of things like record collection, imaging, getting pathology to the specialist, really trying to shepherd that along so that specialist can give the best diagnosis and really help that person get clarity in terms of what their options are and peace of mind that they're doing the right thing. In terms of the conditions, what we really see is demand is around two areas. It came up loud and clear in the survey. Number one was cancer. And the World Health Organization has estimated that cancer diagnosis will grow 77% over the next few years. That's a pretty staggering number. And because of that projection in the shortage of oncologists, we also do a lot of cardiac second opinions. People are told they need a heart valve. They need, we've had people come in who've been or diagnosed and told they needed heart transplants. We help those people understand what their options are. And that's really important, as over or close to half of the counties in the U.S. don't have a practicing cardiologist. So there are care deserts out there. And what we help do is, through this virtual program, help build a link to those locations so that they can access high quality expertise regardless of where they live.
So half the counties, that's an astounding number. I mean, that's something I really wasn't aware of, about the need to really scale access to high quality specialists in this area. Like, that's kind of enlightening to me of how big this need is for it, right? What else stood out in some of the research?
I think some of the things we hear both in the research and we talk to folks who come in and use the program is that, healthcare is hard. And if you need to access a specialist, you and I work in healthcare. We have connections, we know people, we know the right questions to ask. But typical American doesn't necessarily either have those connections or an understanding of the healthcare system to do that. Typical wait times to see a specialist, even if you're located in an area like, with an academic medical center and has the high quality, whether it's a cardiologist or oncologist, wait times can be 3 or 4 months to see a specialist. And we hear a lot of frustration from consumers that I can't get the access I need. So programs like this really help bridge that gap.
Nice. Okay. The research release that I read also talked about cancer cases. What else was interesting about the cancer side of this and the needs there?
Cancer is a pretty common reason that people come in for a second opinion. It's obviously it's complex. It's not one disease, it's multiple diseases. And if you look at various diagnoses like prostate cancer, for example, there are multiple pathways that an individual could pursue: medication, hormone treatment, surgery, radiation, and even radiation. There's multiple forms of radiation therapy that can be used. And depending on where you're coming from, and depending on the initial specialist you see, they may be driving you down one path because that's something they're more comfortable with. It's easy to access, but it may not be the optimal treatment depending on the staging of your cancer, depending on your specific profile. We find with our program about 2/3 of the time there's a change in the diagnosis or the treatment plan. And you think about that, it's pretty staggering number. Often it is less invasive treatment. We do a lot of musculoskeletal second opinions. So in spine cases, a large percentage of spine surgery just really isn't indicated. It's not the best pathway forward. In cancer, sometimes we'll identify that it was misdiagnosed and it's not a cancer, it's something else. Or other times the Cleveland Clinic specialist may uncover it's a more aggressive form of cancer, which is really important to know because as a patient, you need to be looking at much more aggressive treatment.
How are you seeing, on a daily basis, any changes in how people are approaching virtual second opinions? I imagine it's changed since the height of the pandemic, but recently, are there still an uptick in different times of year? I know you mentioned regionally. Maybe we could talk about some more of those regional skews.
Yeah, I think if you look at telehealth in general, it's been an interesting ride in the past 5 years with the explosive growth mid-pandemic, when for many people was the only access you had to your primary care physician. And it really has settled down. We find the demand for specialty virtual care continues to grow. And it gets back to that shortage of specialists in critical specialties. And if you look at the geographic distribution, the specialist isn't necessarily located where you are, particularly for rare conditions. So we see that growth continuing. 5 years ago, people were a little less comfortable with a virtual interaction. We find that they're really, very comfortable with it today and, really appreciate the convenience of it. And the ability to connect with that specialist, I think really helps contribute to the confidence people have that they're doing the right thing for their healthcare.
Let me share one of the stats that was passed along to me in the data, which was interesting to have this number. The research said that virtual second opinions save an average of $8,705 per patient, and they're more likely to recommend an alternative treatment to surgery and lower hospitalization rates than the patient's initial care plans. I mean, so now there's a figure to it. Now there's a cost savings in addition to the access side of it. I mean, I imagine that has only, the need for that has only grown.
Yeah, it's interesting because, at the end of the day, our goal is to help people get access to the best care, get the information they need to make the right decisions. But in this case, delivering the best care saves money. And as you said, our research shows about $8,700 savings per second opinion. And we found high cost procedures, it could be up to $100 or over $100,000 per patient savings. I'll give you an example. A woman from Oregon contacted our program about a year ago. She was told by her local physician she needed a heart transplant or have less than 5 years to live. She came into our program and said, what are my options? We connected her with a heart failure specialist who reviewed her records, her imaging, pathology. Really did an in-depth review and identified the fact that this patient actually would be a good candidate for stenting and could avoid a heart transplant. Now, I personally don't think the local physician was a bad doctor. I think that they just didn't see on a regular basis people with this advanced level of heart disease, and therefore were not able to treat them locally. This individual came to Cleveland for the procedure, and as a result of that, the savings were about $250,000 by avoiding the heart transplant. But if you think about this, the impact and the positive impact that had on this individual who didn't go through that highly invasive procedure, wasn't spend their life on medications to prevent the rejection. So, a lot of positives there. So I think we're pretty proud of the fact that not only are we helping the patient, but at the end of the day, we save the health system money.
Yeah, I love that. What are some other blockers that you hear from patients that kept them from seeking a virtual opinion sooner? You know what I mean? Like those who did eventually come, were there things that they said, once I realized this, or once I learned about this, then this is what finally got me here?
Yeah, I think part of it is, this is a service that hopefully you never need in your life. And maybe if you do, you use it twice. So part of it is, how do we create awareness for the solution when people need us most? So, we work with, for example, we're working with the largest payers in the U.S., and we're partnering with them to do outreach to people who've recently been diagnosed with cancer, to let them know they have a benefit available, to talk to them about the fact that, they can consult with a Cleveland Clinic expert who can let them know, opine on their condition, confirm the diagnosis, and let them know what their treatment pathways are. So I think to some extent there's the awareness and visibility in trying to get to that person at the exact right time they need us. There's also a little bit of a cultural bias towards, listening to your doctor. So that's changing though. People are becoming much more active in terms of managing their health, being much more informed consumers of healthcare. But there still is a little reluctance. We hear, people say, well, what will my local doctors say if, they find that I'm getting a second opinion from Cleveland Clinic? The flippant answer is, well, if your doctor is concerned about you getting a second opinion, maybe you should find another doctor. But we firmly believe, and the Cleveland Clinic physicians firmly believe that, medicine's a team sport. And if you look at cancer, for example, where tumor boards are really the standard of care for ensuring people are in the right path forward, that we help supplement the local care team. We provide a written report and a copy of the written report to the local care team. So we're here to really help supplement and help the local team and make sure that that individual has, again, the information they need to manage their health.
Well, yeah, you mentioned a couple of keys there, right? Of the balance between the consumer feeling like they can successfully navigate those processes, especially when it all isn't with the same provider, when they are seeking a second opinion, when they are seeking anything about their journey, any information that doesn't originate with their current specialist or their PCP, and being able to know what to do with that. And I think we'd all agree that is often not an easy thing to know what to do next when a patient is often at this point, if they are suffering from a condition that has just made their life super hard, it just throws everything else out of whack. And when they're at this point, so many times, like you said, this is something they hoped they never would have had to engage in. And now they have to, figure it out. So I'm sure there are things that are being learned about how to help a patient feel confident along the journey that it's first, worth taking the time to get this done, to get that second opinion, but second, to know that whatever that result is, that people have their well-being in mind, because we can just get so out of place that we feel like, I don't know if I'm ever going to get that answer. And so like there's the emotional journey of it that's just as important to take into consideration when offering a service like this.
Absolutely. It is an emotional journey. And again, if you think about, you've just recently been diagnosed with a serious health condition, it's overwhelming. And generally, most people don't know where to turn. They also don't know what questions to answer. And, as we design the program, one of the core features are our nurse care managers. So every person who comes in through the program, their first interaction is a video visit with one of our nurses. And during that video visit, the nurses really are there listening and say, okay, tell me about your diagnosis. Tell me about, what questions do you have? What are your concerns? Where were you seen? And I think really provide relief in the fact that you've got someone there who's advocating for you and someone who's going to help you along the way in your care journey. But we find that as we're recruiting, training, and developing and the nurse care managers, there really is a certain breed of people who are really good at being empathetic, listening, and really helping people along the journey. We've been lucky that we've been able to hire, I think, some really top-rate nurses on our team. And if you look at the ratings we get, our net promoter score for the program overall is a 71. So we're proud of that, the overall net promoter, but we look at the scores we get on the nurses after the intake calls, it's generally a 9 out of 10. And it's just really a matter of having people who understand what that individual is facing are there to help.
That's a key to all of this is the staffing side, and having that be the person who a patient is going to interact with, having them convey that they are vested in this person's well-being and allay those fears, help them feel some comfort and some confidence along the way. That's terrific that's been part of the service design, if you will. Frank, what else haven't we touched on yet that you'd want to make sure our listeners understand about virtual second opinions, about some of this new data that you have uncovered, or just other trends that you're seeing in the space?
Yeah, I think, the one point we didn't talk much about was the technology we run on. I think one of the benefits we have is the ability to run on the Amwell Converge platform. It really is a state-of-the-art platform that makes it easy for the patient to connect. For example, there's no app to download. We use text messaging and automation to make it easy for that person to sign up. We're put a lot of effort in making the service and the solution available to individuals around the globe. About 3 million members currently under agreements with some of our top payers. And, we see opportunities to continue to grow and really bridge that gap against the significant need that's out there for specialty care, and the fact that access to specialists is not easy and difficult.
Well, what a way to tie all this together and just help us understand what options are available, how it can work, how it can lead people to that diagnosis that they truly do need to be able to move forward with their health. It's been a pleasure to address all of this and to have you with us to say this week. Thanks for joining us. It's been an absolute pleasure speaking with our guest this week, Frank McGillin from the Clinic by Cleveland Clinic. Thanks for joining us today.
Jared, thanks for having us. Great meeting you.